Hey guys, welcome to my channel. I am Neeraj Kharab, a CPC certified coder, educator and a trainer. So in my channel, I'll provide you easy tips and tricks to be proceed in your medical coding career. So in my previous video, I have given you a brief introduction about the medical coding profession, who can opt for the medical coding profession, and lots of tips and tricks from where you can get your certification and all. So in this video, we will discuss about the role of a medical coder and what does a medical coder actually do in their medical coding profession. Coders are important in the healthcare sector, and how does a medical coder play a vital role in the healthcare sector? So the answer is the medical coding specialists play a very important role in each aspect of the healthcare industry because a medical coder is responsible for organizing all the data that is healthcare related and is responsible for ensuring that data is accessible for medical professional at a healthcare facility. So what are the typical roles of a medical coder? So the medical coder, what he do, he review the medical documentation and translate the notes into diagnosis code, treatment service codes and medical hardware codes. So in short, whatever the prescription he got from the provider, he code them into the numeric numbers. So communicate with the medical providers and insurance companies or other payers is also related to its role. So here I'll give you a clear picture when the actual role of medical coder starts. So I'll give in situation. Suppose a patient encounters a physician office or any healthcare facility he come down. So the physician, or we call them as provider, checks the patient and takes the patient history and evaluate them. So after evaluation, the physician makes an clinical documentation based on his observation of the patient, and then these observations, or you can say the clinical documentation, is sent to the medical coder. So now the role of medical coder starts. So medical coder will analyze the whole clinical documentation thing, and suppose it is having 3-4 pages or it can be more. So he will narrow down his research on the documentation and will convert into numeric number. Suppose he convert the whole documentation into the suppose 5 numbers, he converted them. So after converting the clinical documentation into the 5 numeric numbers, then this numeric code is sent to the billing department. So here comes the role of the billing department. So billing department reimburse the payment to the provider, and physician gets his money for his or her service provided to the patient. So I must say the role of medical coder is very crucial here because there are very, you can say, minimal chances of mistakes because any mistake can lead to the wrong billing process. So here I'll show you how a medical coder actually works. I'll give you an example. Suppose a patient had trouble breathing for 3 days. Her urgent care physician referred her to an ENT physician. The ENT performed a diagnostic maxillary sinoscopy. So how should the sinoscopy be reported? So this kind of documentation a medical coder receives from the physician or the provider. So what he will gonna or he she gonna do, she will analyze this prescription, and he will check his code books. So from the code books, he might get an code that is relevant to the description. Suppose I got this code 31233. So what is the description of that code? It says that it is a nasal sinus endoscopy, diagnostic with maxillary sinoscopy via inferior meatus or crania fossa puncture. So this is very relevant to the prescription that is provided by the physician. So what I'll gonna do, I'll code this description into this 31233. So this is how a medical coder narrow down the research and find the appropriate code from the code book. And if we'll summarize his working day into a professional life, so medical coder actually is its main task to include the analyzing the medical charts, assessing the codes, and your codes will be helped when patient need their insurance company to recover the claim, and proper coding will help to ensure the provider is reimbursed by insurer in a timely manner. So guys, in this video, I have given you a brief idea how a medical coder actually works and what kind of clinical documentation he receives from the physician, how he narrowed down his research and find the appropriate code from the code books, and how he converted them into the numeric numbers. So this was a brief idea, and in our next video we will discuss about the CPC certification examination. And if you have any queries regarding the certification, examination, or the training program, you can mention in the comment section, and or you can just drop a mail for that. And so guys, see you in the next video. Do like, share, and subscribe my channel, and I'll come up with you the new suggestions in the medical coding profession, the questions regarding the CPC certification examination, how to clear that. So I'll come up with all the things in our upcoming videos. So keep learning and explore my new videos. Have a great day.